Assalamu alaikum and peace. This is Imam Malik Mujahid, and you're watching Muslim Network TV on Galaxy 19 satellite, which covers the whole United States, east to west, north to south, 57 million subscribers, goes all over Canada and Mexico. You can also watch us on OTT devices like Apple TV, Amazon Fire TV, Roku, or you can download our app, or if you're into watching everything in the universe on YouTube, you can watch us there, but ensure that you subscribe as you're watching. Our website is muslimnetwork.tv. America has a new government, close to 500,000, President Biden says, will be dead coming month. So situation is not good. And not only we have messed up with our dealing with the pandemic, hopefully it can be fixed with good plans and all that. But even before that, 79 million Americans have medical debt problems. That is almost more than 1/4 of the whole country. Senator Bernie Sanders actually says, and he has been challenged on those statistics, that every year 500,000 Americans file for bankruptcy because of the outrageous medical bills. The American Journal of Medicine reports that nearly half of the people who experience medical bankruptcy mention that it is the hospital bills which is causing all of that. And 22% of consumers with debt in collection have only medical debt. So they are responsible people. They have no other debt but just the medical debt. And 54% of consumers with medical debt have no other debt listed in their credit reports. So they are responsible people, but unable to handle. Some of them have 2 jobs. So it's a national problem. It will require a whole lot of thinking to handle it as a nation. But there is a Muslim physician from Pakistani heritage in Arkansas who had done it in his own way. He started a cancer treatment center. And as he was closing and devoting more time to his professorship, he forgave more than $650,000 of unpaid medical bills to 200 or so of his patients. And he is with us on Muslim Network. And Dr. Omar Atiq is his name. Assalamu alaikum.
Assalamu alaikum, Imam sir.
Welcome to Muslim Network TV. Dr. Omar Atiq is a professor of head and neck surgery at the University of Arkansas for Medical Sciences, and the former founding director of Arkansas Cancer Institute in Pine Bluff, Arkansas. Well, thank you so much for your generosity.
Well, thank you, Mr. Mujahid. I've known of your work for a long time, mashallah, from starting Sound Vision decades ago when we used to get stuff for our children from you, and we appreciate that. Just as minor correction, my secondary appointment is head and neck surgery. I'm an oncologist. I'm a professor of medicine, nothing important. Glad to be with you. I'm happy to share this hour with you, and it's good to see you, mashallah. You're doing well as you were 20 years ago or 25 years ago when we first met. You may not remember that.
Wow, so we have met in person. I didn't realize that.
We have a common friend, Dr. Khalid Riaz.
Oh, yes.
We have met at ISNA meetings, and we have, I think, met otherwise too. But
well, it seems oncologists have better memories than political scientists.
Well, maybe it has more to do with the fantastic work that you are doing and you have been doing all around in the country and on the continent on behalf of Muslims and others. That makes you more memorable.
Well, thank you so much for you continuously are generous towards me as well. But show is about you. If you have not forgiven this particular loan, what would happen to these people?
Well, let me start by saying this. We were blessed with an opportunity and took it. So I want to make sure that, and you have mentioned that earlier in your segment, in your introductory segment, that the issue is not about loan forgiveness, the debt forgiveness. The issue is the debt. Having said that, of course, people who cannot pay debt when they're in debt, life becomes very hard for them. It becomes hard for them not only in a material sense, but also emotionally and intellectually. None of us wants to be in any debt of whatever kind. And so, and that's why, as you know, in our Islamic tradition, forgiveness of debt has a very important place. And, they would have gone along. There is a God up there who takes care of all of us, one way or the other. And we all kind of help each other in different ways. This was a small way that we were able to do that, and happy to be of value to our neighbors and our community.
If the debt was still there, how long it would have taken these people to pay off? Because I read somewhere that they were paying $5, $10, and it seems that was their capacity. Or some of them, is it possible some of them might end up in bankruptcy court?
Absolutely, many of them would have, and it would have taken them years, if not maybe even a decade or longer. And that's assuming that they had the means, and that's assuming they had the life. So yes, it's a terrible situation, without question, and embarrassing one for those of us who are somewhat luckier.
And for the whole country, and we'll get into the detail of that. But it seems you opened this Arkansas Cancer Clinic in the community of Pine Bluff to ensure that those people who are economically disadvantaged benefit from that. So is the selection of the site was based on your demographic understanding that this is where the people are underserved?
It's interesting. Yes and no. So when I was finishing my fellowship in Manhattan at Sloan Kettering, I was planning to go back to Peshawar, from where I was born and raised.
To Pakistan.
And as you may know, Memorial Sloan Kettering is one of the leading cancer centers in the world, in our country. And so I wanted to go to a smaller place to make the transition from going to the first center in the first world country to a developing country and starting a new service. So somewhere in there, Pine Bluff became an opportunity for me to make that, to be a bridge from me going from Sloan Kettering to Peshawar. And of course, the second step never happened. Well, it didn't happen. But that's how I ended up in Pine Bluff.
So I still want to understand that. So before patient from that area will have to drive about an hour to get to some place before you open that.
Yes.
So how this calculation comes into being? I mean, you have to do some research, sociological research, or engage business people, or you just jump into doing it?
No, not really. Growing up, making long-term plans was not something that was my forte. It was living the best you could today and leaving the tomorrow to Almighty. And so it's an opportunity that came up, which was a small town in a small state, far away from the cultural centers of Chicago and New York City and Los Angeles. And we took that to take a step down to start a new center at a place which didn't have any, so that would help me to go on to Peshawar. But the other thing is, when you go into medicine, I don't know of anybody who goes, well, I haven't seen anybody who goes into medicine for anything else other than serving your neighbors and your communities. This just seemed to be the right place to go to. And frankly, it's all fate. If you would have asked me when I was in Chicago doing my internal medicine residency in late 80s, if I were ever go to Pine Bluff, Arkansas, one, I didn't know where Pine Bluff, Arkansas was, and two, my answer would have been no. Things happen.
Interesting. And so it is, I mean, you told this to CNN that you never refused a patient for any reason.
That's
The
correct.
issue is you're the physician, you're the boss, you're sitting somewhere inside, and it's the front desk person, which people like me will approach and say, where is the insurance? I have no insurance. Well, why don't you go to that place? So were you able to instruct your staff and train that, okay, nobody should be refused? How, I mean, you may not know when refusal might take place.
So absolutely, the answer is absolutely yes. You know, since it was my own clinic, and since I had started it, I had my instructions to everybody in the office was, any patient who comes to our doors, we will see them. It doesn't matter whether they have in those days, this was before Obamacare or ACA, people didn't have insurance. And I made it simple. I said, I have time. My time would be better spent seeing a patient than not seeing a patient. And so that really was never a problem. Now, is it possible that our staff would have returned a patient who wanted to see me? I would be hard pressed to believe that. Because I would have come to know about it. The entire staff was geared towards, we are here to see patients and treat them, and everything else will follow. So alhamdulillah, I think that went well for us.
Now, how many physicians which you know or you might have studied who follow this particular practice that see whoever comes?
I think I would like to think that I haven't read into it. I would like to think that the majority of the people do that in some way, shape, or form. You know, you're all human beings. We want to be useful. That gives us a purpose in life, and it's a more important purpose. And I'm not trying to be Pollyannish here than making a living. Of course, making a living is important. Please don't take me wrong. But, you know, I know of a lot of physicians who do that. And I believe they're happy and they're content. And maybe even happier than those who don't take patients or who somehow select their patients based on criteria other than their expertise. Now, of course, if a patient comes to me that I'm not an expert at dealing with, of course, I'd send them to another person. But I think there are a lot of people who do that. Now, there may be some who don't. Everybody lives their own life. You know, who are we to judge?
Yes, so probably those things happen when and more in hospitals and places like that. I have experience both ways, but I thought since I'm a community person, people, you know, without being insurance, I have found that I could handle, but both ways are possible. Well, in America, you know, survey after survey, Gallup does a survey of which profession is more respected in the country. The politicians and the media comes at the bottom 2, 3. But physicians are among the top 2, 3 professions, and probably people feel what you say in their heart when they rate physicians as among the top like professions in the country. Other two are teachers and military. You're watching Muslim Network TV. This is Imam Malik Mujahid. I'm talking with Dr. Omar Atiq, and we'll be right back after these messages.
Assalamu alaikum. My name is Adam. You remember me? I appeared in so many episodes that Sound Vision has put on the market. No matter what. Hey, what's happening? Hey, oh, sorry. Lockdown is what it is. Well, continuing here. In this lockdown, Sound Vision never stops thinking about you, the viewer. We'll have to get back into production again, online and inline. Everybody in their own space, even me. Although I'm stuck with Lanisa.
Salam! Salam! Salam!
I know, you were shocked too. Well, let me continue. This is what I was going to say. Salam! 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 Cut! 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 Finally, I get my own screen time again. Thank God. And so we invested in new equipment to bring you even better production with new songs and new singers and animations. Well, here are a few clips. And Sound Vision has brought all this into your home, making Islamic values and teachings easy. And if you know me, Adam, a multi-talented actor, well, sometimes I'm an actor and the reporter and the... Oh, that's enough. Let's move on to the next section. Well, you can watch these new episodes on our new app at www.adamsworldapp.com. We have previews happening every day on Muslim Network TV. Sound Vision has been serving generations, moving and changing with the times. We are all faithfully connected. That is a huge blessing. Your donation helps keep these programs available now and into the future. We take this job of helping tomorrow's Muslims today seriously, and you should too. Today, we need your help. Children absorb and learn from everything they encounter. Make that wholesome, positive, grounded in our faith. Together, we can accomplish our goal of raising better Muslims, better neighbors, and better citizens. Please donate generously. It's an investment in our future. But to finish, let me tell you, there are new scripts of my new mission. And it is something that I enjoy talking about. My new mission is space. Houston, we do not have a problem. Salam, see you soon.
Welcome back to Muslim Network TV. This is Imam Malik Mujahid talking with Dr. Omar Atiq. One of the statistics are that people who are in medical debt, 70% of them say that they try to pay while cutting back on their spending on food and other basic household items. I was horrified to read that, but it was authentic survey by Kasser Family Foundation, published in New York Times. One of the things which they say is 34% of those people who surveyed, they say that doctors never explain the cost of procedures to them. And that's how they got into the debt. So what is the process doctors normally use? So I thought they probably, if not physicians, maybe the physician's assistants or the receptionist or accountant, somebody should explain beforehand how much it will cost, right?
That is a very important aspect of medical care in our country, that it is the payment system and the billing system is rather opaque. And it depends, believe it or not, on the insurance you have many a times. Because various insurances, including Medicare and Medicaid, have some set rates with physicians. And those who do not have any insurance actually could be charged more. That's the cruelty of the system that we have. And frankly, many a times, physicians do not know the cost of their service.
So it's not that they're not telling, they themselves don't know what is going to be the cost.
If you were to ask me now, after 30 years of being in practice, what is the cost of treating a breast cancer patient for 1 year, I would make an educated guess. That's the truth. Now, I could get all the numbers. My staff could probably get all the numbers and give you those numbers. And more, the healthcare systems are doing that. And now, as you know, the federal government has mandated that hospitals who take Medicare should post their charges. So there is a certain transparency that is needed, which would be important. But our healthcare system is a myth, and it is untenable from any aspect you look at it. There is a lot that needs to be done. And in fact, just within the last couple of weeks, the American College of Physicians, of which I'm a member and sit on their board of regents, and actually I'm the chair of the Health and Public Policy Committee, came up with policy papers addressing the issues of social determinants of health, which includes, of course, the ability to pay, and many other issues having to do with discrimination based on that, because it recognized that our healthcare system needs a significant revamp. And there is a certain element of push towards that. However, people who are disadvantaged economically, socially, educationally, unfortunately bear a huge brunt of the dysfunction that we have in our system.
So there is no way a physician probably is busy focusing on the patient. And instead of getting the mathematics, okay, which insurance it is, how much they're going to pay, and how much we should to tell them, probably the insurance also have a very lengthy checklist of deciding, because each patient, they may have multiple policies. So the complexity is such that it's not like a shop, you enter and say, okay, this is the price and this is on sale and all that. So system is complex. And so since you're on a policy table of what is called American Medical
American College of Physicians.
American College of Physicians. So the simplification, are they recommending some simplification of the system, as hospitals now, you're saying, are required to list what is going to be the cost?
So yes. So one of the so you have to have priorities. So the first priority of the college, and it's the largest medical society, specialty society in the country, the largest priority was to have access and affordability, and that paper came up about a year ago. And so what we are trying to do is to make sure everybody first has access while we clean up the table, because we know it would take a long time to do that. The easiest way to do that is to frankly have a single payer system, because you know what would be paid, you know what would be a copay or deductible if there is one, and that would be true for everybody. But our country doesn't run on that system. We have our numerous insurances in every state, and every state is different. So yes, so there is a push towards saying, let's make it simple. The system is so complex, so cumbersome, and so expensive that even educated professionals find it hard to decipher their bills. I'll give you my personal example. Thank God we have been healthy, but sometimes you have to go to the hospital and get surgery or get other things, and we've had that in our family. I have not been able to easily look at the bill and know exactly what was charged for and what was done. And I'm a physician.
That's interesting. And sometimes they charge. I was able to read one of the bill a while ago, and they had charged for 2 Tylenols for my wife, who was hospitalized at that time. For 2 Tylenols, it was $8. And I say, what? I could have gotten the whole bottle from the next door. So that's interesting. So, but you mentioned that, is it your opinion that single payer system, or do you think your organization and medical professionals also are recommending that system?
So actually, so there are pros and cons, as you well know. So even in Europe, there are different systems. UK has a different system than Germany. Germany has a different system than France. France has a different system than Austria. We would have to come up with our own system. It seems to us in organized medicine that physicians, nurses, the medical system, and the country is probably not yet ready for a simple single payer system because of the bureaucracy that it would come with it. Remember, that system would be dealing with about 18% of our economy, about $3 trillion. And so, but there has to be simplification. There has to be where anybody who goes into a doctor's office knows what the charges are, what the payments are, and what he or she would have to pay. If they go into a hospital, as you said, charging numerous times the cost that you can get at Walmart or Walgreens is mind-boggling, but it happens just like it happened to you. So there are a number of different people looking at different things, but there is no consensus, unfortunately, yet, even in the medical community, as to how to really handle this. There are people within the medical community who think that the system should stay as it is, that it's a free enterprise that comes with, is healthcare a right or a privilege? There are many people who believe it's a privilege. There are others who believe it's a right. So there are nuances to this whole discussion that are as complex as the rest of our society is.
And yes, I understand. I mean, as complex as the rest of our society was the one which I was dwelling on. I mean, the way we are treating the pandemic, the way we have treated white supremacists, it seems the complexity of the society is present in all those areas. But you mentioned several countries of model of single payer systems. I have this cast here that most of the bankruptcies because of the medical debt were because of the hospital stay. And in the US, it cost $5,220 per day as compared to just $765 in Australia. That is a huge difference. So you probably are familiar with it. Which country system you rather have?
So this is my personal opinion. Of course, I'm not representing any medical organization at this time, but having looked at all systems, I'm not as much wedded to a system as I'm wedded to the idea that healthcare is a right. And I'm wedded to the idea that in the most prosperous country on the planet, nobody should have to worry about medical debt, let alone go bankrupt from it.
So
it would be much simpler. I mean, we can look at some form of Canadian system without the long waits. We are not used to long waiting. We cannot have that. We can look at the Scandinavian system. It seems to me that eventually we might come to something like a combination of Austrian, German systems, where there are health insurances, but every citizen, every person is guaranteed health care. How it is paid for is a different situation. So I would like us to divide it to where first we should make sure that all Americans should have easy access to affordable health care. And affordable, the word affordable is different for different people. It should be affordable to one who has nothing, no material possessions. That's what I meant by nothing. Everybody has something. And then the economists and the health economists deal with how to pay for it. We have paid $7 trillion for wars that have given us nothing except misery. Death of our own young men and women, and death of young men and women abroad several times more. It hasn't made us safer. It hasn't made us any better. If we can spend $7 trillion on that, we can spend some money on taking care of our own people. How it's done, it's beyond my expertise.
Well, you sound like a Bernie Sanders supporter.
My wife for sure was.
Do you think, the way Biden administration has been talking about on the presidential debates and all that, he seems to be building on what President Obama has in terms of Obamacare. Do you think cost of the medicine and treatment will continue to grow in near future?
Unfortunately, the practical answer is yes. The real answer is it shouldn't. It's not tenable for our country. We are spending, as we mentioned, 16 to 18% of our GDP on healthcare, with no better statistics than people who spend far less than us on it. It just doesn't make any sense. So we have to reform the system. And I believe that after President Biden has taken care of the COVID-19 pandemic, which has been so mishandled, it is obnoxious. and has handled other things. He would come to that. But frankly, all of us as a country, as a nation, as communities, as community leaders, as physicians, as lay people, have to come together and demand something that's reasonable and appropriate.
You're watching Muslim Network TV. This is Imam Malik Mujahid. I'm talking with Professor Dr. Omar Atiq about the medical system and the debt. He helped people liberate from some debt, but the whole country is in debt. This, it seems like. We'll continue this conversation after a short break.
My wife, she's a professor at the University of Cincinnati, who's Catholic, and by her watching and listening to our 3-year-old son watch Adam's World, she ended up taking Kalima Shahada. She embraced Islam because she learned so much about Islam and the other prophets. It really affected our life in a great way, and because of Sound Vision and Adam's World, we're Muslims.
I took my Shahada 15 years ago, and I actually am from a rural part of Ohio. And so I found the catalog for Sound Vision, and I ordered the tapes and the CDs and the books, and I used those, and especially for my little daughter, that's how we basically learned our Islam, and Islam entered our hearts through the wonderful works of Sound Vision.
Okay, assalamu alaikum, brother. I just want you to know that I love the Sound Vision website, that a lot of times when I'm looking for information, especially as it relates to homelessness, domestic violence, and women issues, I go to that website, and then I see what you've written, and then I copy and paste it, and spread the word, because the wisdom is there, so I can't do any better than what Sound Vision has already done.
Sound Vision is our survival guide. It is the organization that provides skills for Muslims how to survive and thrive in this community here in the U.S.
Assalamu alaikum, my name is Anam, I'm in 11th grade, and I grew up with Adam's World, and what it taught me was unity, respect, and love for the Muslim Ummah.
Adam's World is the greatest show ever made. Take me to the Kaaba, man. I love that puppet.
Welcome back to Muslim Network TV. This is Imam Malik Mujahid. I'm talking with Dr. Omar Atiq. You mentioned before the break that hopefully Biden will find some time. I mean, he has so many things to handle. Although he seems to have started, I think he has already signed probably 30 or so executive orders in his priority areas of focus, and sent a couple of bills to the Congress to pass. So reforming the medical system, hopefully he will get to it. But if you were to recommend him 3 or 4 first steps in the next 100 days, what would those be in the area of medical care?
One thing that has been talked about a lot, which I think should be available is an option, is a public option to our Medicare program. Anybody can have private insurance if they want. That's their choice. But anybody who wants to get a public option should be able to get that and pay for it in affordable manner, which should be tied to one's income and wealth. That would hopefully, and it has been shown that might be able to take care of most of our access.
Is Biden willing to do that?
That I don't know. But that was talked about, if you recall, even in the ACA or the Obamacare, as it is known. But it was rejected by big insurance companies because it's against their personal interests. But a public option is the right way to go, simply because it doesn't take anybody who wants to have private insurance, it's there. But a public option is an option for anybody who doesn't get insurance or likes to get Medicare and pays for it if he or she can afford it or gets public subsidy, to be on it. I think that is doable. That should be done. That is, it has been looked at. That's number one. Number two is there has to be competition in prices. We say we are a free country, and we say that we believe in free competition. But in the drug industry, we don't believe in getting our drugs from Canada or UK, let alone, developing countries. I mean, how's that fair? If I'm a free man, I should be able to get my medicines from anywhere in the world. Now they talk about, well, they may not be safe. That's my choice. I can bet anything that medicines in Canada are safe. We should be able to import medicines from that. There should be competition, and there should be price competition. And I think at some point in time, although my colleagues may not like this, but I think we should be able to tell patients what a service will cost so that there is true competition between various people who provide that service. Those things can be done and can be easily done even without major legal maneuvering. Again, as you just mentioned, there's so much on the plate. We don't know where this will land.
So with all the computer programmings and all of that, it should be easy for all insurance companies to put their formulas in, and instantaneously one should be able to compare right on Google, a calculator. If I go with this, if I go with this, if I go with this, what will be my cost? And that will drive the competition, which might lower the cost for people.
For all those who believe in the capitalist system, we just need to invoke that system, that competition, into the healthcare, right? I mean, so yes, absolutely. I mean, I think it can be done. It should be done. I think it's about high time that we look at the cost.
Now that you have closed your Arkansas Cancer Clinic, you have some time. Are you going to become an advocate for these three things which you suggested?
Well, actually, I've been doing this for a long time, Imam Mujahid. When I first started, I've always believed in being a part of the community. So when I was in Arkansas, even in the first year or 2 years, I was a part of the community. And so I've been a member of our county and state medical society. In fact, I was one of the first non-white presidents of the Arkansas Medical Society. And I now represent the Arkansas Medical Society in the state of Arkansas to the AMA House of Delegates. And the reason for that is to promote some of these policies and to ask questions. That's the same work that I try to do with the American College of Physicians. The idea is to ask questions for the greater good, because eventually those of us who believe that the system is helping us the way it is, there will come a time when in our future generations, they may be on the other side. And I think we have to look at a fairness and a justice in the system, which is our tradition. If our Islamic true tradition is fairness and justice. And that is our contribution to this society, where we have been lucky enough to get a seat on some tables, if not all of them. But unless we do our contribution, and that's what I try to do the best I can.
Are you finding, in the places which you mentioned in Arkansas State and American College of Physicians, are you finding, more and more people are wondering about the questions and are serious enough to have an impact?
Yes. And my greatest encouragement comes from our youth. They are fantastic. They are much less judgmental than our generation and those above us. They are far more egalitarian that I can see. They have a finer sense of justice and fairness. And I believe we will not be here, but this nation and this country and hopefully this world would see a much brighter future. So yes,
younger physicians who are coming up, they are on board with these ideas?
They are on these and even more. Yes, I have seen that. Just to give you one example, if you have time, AMA, the American Medical Association, was always against so-called gun control. About 4 or 5 years ago, the AMA House of Delegates, by the push of the younger physicians and women's and minorities and the American College of Physicians, passed a resolution that violence and violent crime was a public health crisis. So this is because of younger people. So yes, I am very optimistic about them.
Great. Let's get a little bit on a slightly different topic. At the University of Chicago, where I went to school long time ago, a couple of years ago, a report came out that 50% of Muslim physicians who were surveyed said they are discriminated against at workspace. And a good number of patients refuse to be treated by them. And now I see not only you have spent substantial amount of your life practicing, but also I saw somewhere in the report that all your children are physicians or in the process of becoming one. So what has been your personal experience in this area?
So my answer might come not only as a surprise, but also as contradictory to the absolutely appropriate surveys that you have talked about. I have never felt discriminated against. Now, that may be because discrimination comes out of ignorance. And if there was any, I may have just attributed it to ignorance. So I have had so much given to me as a physician that I can't complain about any discrimination that may have happened. And I don't honestly recall. If I look, there may be, but that's not my concern. Somebody else's view of me is not my concern. My concern is what I do. And if somebody tries to take my due right, then I work in the system to try to manage that and handle that. And that's what I have taught. We have, both my wife and I have taught our children. So I'm sorry, I can't give you a better answer than that.
That's good answer. tell me this. Most likely you're a graduate of Khyber Medical College in Peshawar, Pakistan, right?
Yes.
Okay. So Khyber at that time probably hardly has any fees. So you graduated without any debt, most likely. Is that correct?
I not only graduated without any debt, I was given a scholarship. So I was actually given some extra money to become a physician.
Wow, same is true about me, although I chose not to go to medical school, but wherever I went, I was given a scholarship. Do people in America know there are alternate systems of education?
Not as well as you and I would like to believe. Do they know? I think people who want to know it, but and this is just my hunch, that the majority probably do not.
Because just like medical debt, just like debt because of the medicine, I think college debt is a big issue as well. So, so while we have taken so much from a country, and then here we also are blessed with so many things, how you are thinking of the way you contributed to Arkansas? What are you thinking of contributing to a country which essentially not only gave you free education, but gave you some money to get educated?
Absolutely. So it is absolutely the most important question that anybody could ask. Since leaving Pakistan more than half my life ago, I have tried to not forget, one, where I came from, two, to do what I could within the realm of my abilities to give back. As you know, Imam Mujahid, we have an organization called APNA, which is a physicians organization. I happened to be a president of that some years ago. And I was involved in a program called Apna Sehat, which was started by Apna in 1988 to improve. It started with basic health care in poorest areas of Pakistan, and then it expanded to improving the economic situation. And Human Development Foundation of North America, that I know you're well aware of, and our mutual friend Dr. Khalid Riaz has done tremendous work there, besides many others. We were all a part of that. More importantly, I think what in our opinion needs to be done in Pakistan is different than what needs to be done, of course, in our adopted homeland. In Pakistan, the biggest issue is just preventive healthcare. As you know, there's more bang for the buck in prevention than it is in cure. And many of us have worked towards that end in Pakistan. And in fact, this concept of Apna Sehat and HDFNA was then taken in Peshawar government by one of our own, Dr. Naseem Ashraf, who happens to be a Khyber graduate and a cousin of mine, to the National Commission for Human Development for grassroots empowerment in the country. It had done extremely well, and it was very successful to an extent that it is still there. But then, unfortunately, the successive political governments just totally ruined the caliber of the program by inducting people who really shouldn't have been inducted into that sphere. So we work on that, and of course, one of my dearest emotional tributes might have been to be a part of a movie called Jinnah that we made on the person who made Pakistan possible for us. This is not to say that I have paid the debt that I owe. I would never be able to pay that. But to be able to continue to strive in our own way for fairness and justice not only in our adopted homeland, but in our motherland, is really incumbent upon us. I mean, it's to me, that is the debt that I have to continue to pay, and I have to continue to be cognizant of.
So
I don't know whether that's answered your question.
yeah, it does. Thank you so much. But do you think these second generation Pakistanis, they will continue the tradition which Apna started with the Human Development Foundation and Apna Sahat and other programs, because they benefited from there. Some of them worked with you to strengthen that system. But if that system is dependent upon funding in the US, is the second generation of physician, are they taking a part in their parents' home country benefits as well?
Not as much, and for obvious reasons. You know, for them, their place of birth and their country is United States or Canada, depending on where, where they were born and raised. But they have heritage. Some are doing a lot of work. Some may not be. Eventually, it comes to the people who are living in a certain society and in a certain community, who are born and raised in a certain way. There is something to be said about, being from a place that gives you the affiliation and the association and the fondness that cannot be pushed into another generation. So I think many of us are trying that our heritage is passed on. Most of us try that, I suppose. Whether or not it is remains to be seen. I'm just hoping that our next generation would not, even if they don't look at India or Pakistan or Bangladesh or any country that they have come from as their country, they would look at the fairness and the justice that's needed in those societies. Because the reason countries are poor is not because they are poor in resources. It's generally because of poor habits of some, a few, those who are entrusted with leadership.
Well, thank you so much, Dr. Omar Atiq. I truly appreciate your time, truly appreciate your generosity in time, as well as helping your patient, who probably many of you already know in person because you have treated them. And thank you for our producer, Dr. Abdul Wahid and Sherdil Khan. And thank you for watching Muslim Network TV. It's always there 24/7. Stay tuned for further programming. You have been watching Muslim Network TV on Galaxy 19 satellite, or Apple TV, Amazon Fire TV, Roku, or your own app. If you don't have one, you can download our website, or if you're a YouTuber, you can always watch there on Muslim Network TV. And do remember to subscribe. Thank you. Peace.
Thank you very much. Thank you for the opportunity.